Good afternoon, everyone. Can everybody hear me okay?
Yeah.
Yeah, brilliant. Okay, we will get started. So welcome to the second webinar hosted by Calm Your Mind, which is Halton's men's mental health campaign developed by local men for local men. For those who don't know me, I'm Kate Basley. I'm the local mental health lead, and I lead on the suicide prevention work that we oversee. Before I connect us all to our brilliant colleagues from James's Place, just want to go over a few housekeeping points and set the scene. And we will have a few more colleagues, I think, joining us just as they trickle in, which is absolutely fine. So as you can see, hopefully, the webinar is being recorded just so we can share the learning with as many people who aren't able to attend today. After Andy's presentation from James's Place, there will be opportunity to ask questions. So if you're quite happy to be on camera, then just use the raise your hand function at the top of your screen and we'll be able to take those in order, but hang fire until the end of the presentation if that's okay. If you'd prefer not to be recorded, you should have a Q&A function at the top of your screen. Just pop your question into there and I will read that out for you. That's not a problem. Keep your videos on if you want, keep your videos off if you prefer, that's entirely up to you. But if you can keep yourselves on mute, that will be brilliant just while Andy is presenting. Just before I hand over to Andy from James's Place, I just wanted to take the time to try and focus our attention really as to why we're all here. I'm assuming most of you will know that 75% of suicides nationally are men. There will be variation across geography and slight variation in age ranges, but ultimately that is the size of the problem, that the majority of suicides, unfortunately, in the UK and potentially worldwide are men. Now, locally, we have seen a slight decline in some of our suicide rates among middle-aged men. So that's the age range 45 to 64. It is lower than the England average. It's still high, but it gives us a sense of what we can achieve when we all work together. And it's a small step in the right direction. However, what we are seeing recently is a potential rise in the younger age range in men. So looking at that 25 to 44 age group. So we're hoping today, not only will our colleagues from James's Place be able to give an update on the brilliant therapy they provide to men in crisis, but also give us a bit of an insight into some of those issues, barriers, complexities that men locally are facing, and how we can all work together to support them better. So hopefully, I know Andy is available. He is on the call. Are you able to share your screen, Andy, if I hand over to you?
Hi, Katie. Hi, everyone. No, at the moment, it's not letting me share. I think we're just trying to sort it out. I might need to be made host or co-host.
Okay, the joys of technology, always fun. So we'll just see if we can figure that out.
I have yourself and Claire as hosts and co-organisers, so it should let me go in and see if there's anything else I can do. The joys of technology, indeed.
Thank you for the introduction, by the way, Katie. So my name's Andy Noon. I'm the head of service at James's Place in Liverpool. The service I hope a lot of people here today have already heard about, but if not a problem. I suppose that's a big reason why we're here today. So my role at the service is overseeing the clinical work going on. My background was in mental health nursing, working in inpatient and community settings before moving across to the third sector, working with charitable organisations. And for the last 2 years, I've had the privilege of working with James's Place, supporting men in the Northwest who are in a suicidal crisis. And I'm joined by Claire. Claire, if you want to say hello for us.
Yeah, hi. So I'm Claire Chambers. I'm one of the senior therapists here at James Place. I have been in the Liverpool team for 6 years this month. And yeah, so we deliver the intervention to the men, and yeah, I don't know what else to say actually at the moment, but yeah, nice to see everybody.
Yeah, we're just working on some, obviously getting us in a position where we can share the presentation that we've got today, but it's a little bit about the history of James's Place as a service, explain a little bit around, you know, how we operate, what makes us unique, what makes us different, I suppose, a different offering to people who are in a suicidal crisis, and then probably really importantly, giving you information on how to refer into our service moving forward if you do come into contact with someone who is in a suicidal crisis, whether that be yourself, a colleague, a friend, or a loved one.
Andy, sorry
Yep.
to interrupt. I've redid those settings, but I don't think it's giving you any. It's not letting you share, is it, or host or take
No.
control? Do you think it might be worth sending me your presentation and I can share?
Just bear with me, let me do that. One sec. Apologies, everyone. Just bear with us.
Just wondering if that's not going to let you do that at this moment in time, Andy. Is it worth you going through your presentation minus us being able to see it, and we'll figure out a way to share it with everybody when we send out some further information following the session? That might be easier for now.
I'll do that now. Just bear with us. Let me try and send this, and then if not, I'll do that. Yeah, it's still not letting me with the video being part of it.
Right. Okay.
Right. Okay. Do you want me to, Aileen, Katie, do you want me to go through verbally what we do as a service?
Yeah, that'll be great, and we'll figure out a way to get the presentation out to everybody if you're happy to share that afterwards.
Yeah, no problem. Just have to look at the compression of it with the video. We're not trying to take the video out and point people in the right direction. So, as I mentioned, everyone, really apologies about the visuals not being here today. I'm here to talk about James's Place, as I've mentioned. So, I suppose talking about the bigger picture of suicide and suicide prevention for us working with men in the area. It was mentioned earlier in the intro that in the UK, men are 3 times more likely to take their own life. Suicide is, terrifyingly the leading cause of death for men under the age of 35 in England. And in 2023, there was 4,506 male deaths in England and Wales, which was the highest rate since 1999. Along with the general suicide rates in the country at that time. So clearly there's a massive need. There's a massive need for support services like ourselves and other organisations that are doing great work in this space. So people often ask us at James's Place, why are men, sort of such a high risk of ending their own life? And it's very difficult to give a direct answer of why, because it's such a complex situation that's going on for people. But we do know through looking at our data that there's a lot of adverse life events that men experience that lead them into a crisis and can lead them into our doors at James's Place. And those events include things such as bereavements, relationship breakdowns, family problems or family stresses, workplace issues, and economic problems as well. So we've seen an increase in the need of local communities, not just men, over the last couple of years with the cost of living crisis and the impact that's had on people's stress and overwhelm. But I think it's important to note that that doesn't make those incidents themselves don't make someone take their own life or more at risk of taking their own life. I suppose it's what they lead to. So we know that these situations often lead to people feeling defeated, feeling trapped and feeling stuck in their circumstances, having a feeling of not belonging or being able to fit in, quite isolated, and ultimately people feeling quite hopeless about a positive future. So that's the learning that we've been able to do since opening our doors at James's Place and working with men. We've been able to understand what situations are going on for men, but probably more importantly, how does that impact men psychologically and sometimes even physically as well. So moving into our part in this then, and our part of trying to be a solution to this situation. James's Place was set up in 2008, and that was following the unfortunate death of James Wentworth Stanley in 2006. Now, James is a 21-year-old young man who didn't have a long-term mental health diagnosis. He didn't have a mental illness. What happened to James is that he went through something in life that he found very distressing, he found very overwhelming, and he went to speak to somebody about the suicidal thoughts he was having at A&E, and unfortunately wasn't able to get the support that he needed, and he left before he could be seen, and unfortunately took his own life. And the pain and the grief that James's family went through, they wanted to come together to provide a service for men in his situation to be able to access, free life-saving therapy within days, very quick turnaround, sat in front of a professional, free of charge. So that was always the idea behind James's Place, and our work is informed by their loss and the memory of James. At James's Place, on the back of that, we believe that men in suicidal crisis need to be in a space where they feel valued and they feel respected. So a big part of the presentation, and hopefully you're able to have a little look through when the slides are sent across to you, but the environment is a big part in what we do at James's Place. We believe that men need to be in a space where that respects them and sort of helps them to feel valued. We deliver a proven, a safe and effective intervention. So I'll talk about it in a little bit more detail, but we are evidence-backed by John Moores University, who have been carrying out all of our academic research. And ultimately, we help men experiencing a suicidal crisis find a renewed sense of hope. So a little bit about James's Place timeline then since starting. So as I mentioned, James's Place started as a charity in 2008. And for a period in time was a grant giving organisation, so would often provide local funds to suicide prevention organisations who were carrying out really good work with people. But that idea was always there for a space for someone like James to be able to access what I've already mentioned. So the planning stage started, and in 2018 the first centre was launched in Liverpool. As a lot of people might be aware, the Northwest has got an extremely high suicide rate, the highest in the country, unfortunately. And it was decided that Liverpool would be a really good area to have the first James's Place Centre. As I mentioned, we started working with John Moores University, and on the back of that evaluation, on the back of evidencing the impact of our work, we were able to open up in London in 2022 and in Newcastle in 2024. The further plans that we do have, we're opening up Birmingham, which should be open at the start of next year. So the centre's ready now. We're going to be starting to move towards. We're just getting the staffing ready. And then we'll have a 5th centre by the end of 2026. And that is the idea behind that is over 2,500 men per year will be able to receive life-saving therapy support by James's Place. A little bit about how we operate then and what we do. So our James's Place model is based on 5 components. The first component is the man themselves. That's the most important thing to us at James's Place. Us putting ourselves in the position of a man who accesses our service and making sure that it's it's safe and it's effective. We use a very unique intervention called Lay Your Cards on the Table. Claire's going to tell you a little bit about that in a couple of minutes. So I won't go into that too much, but it's a very unique intervention that we can help us to get to the heart of the crisis with the men. We have rapid access. So when I deliver these presentations, one of the biggest questions is always, how long does it take? It sounds great, but how long does it take? And it's quite simple from our perspective. We have no waiting list and it's very quick to access. So when we do receive a referral, we look at that referral that same working day. And if we believe we're the right place to support that person, we'll offer a welcome assessment within 2 working days. And that's an opportunity for us to find out a little bit more about them, for them to find out more about us, and collaboratively working together over a 6 to 8 week period, delivering typically 6 to 8 sessions of the therapy that Claire will talk about in a minute. The third stage of our model is the suicide prevention therapists themselves. So, as I mentioned, I'm a mental health nurse, Claire's a counsellor. We're all registered with a professional body. We do have social workers, occupational therapists within the James's Place wider team. So we're from a varied healthcare background, if you like, and we're all registered with a professional body. We're all very highly trained in suicide prevention therapy. So we're all very, we're confident in dealing with the situations that we're dealing with in terms of men in suicidal crisis. The fourth component of our model is the environment, which I've mentioned. What I will say with this, we do have open days every 2 to 3 months. I'll be more than happy to keep using the loop with when those next ones are going to be. If you were free and wanted to come up to the space, find out a little bit more about us as a service, but see the environment for yourselves, because it is, and I feel incredibly lucky to work there every day. And I know the men, when they walk in the door, they're very taken back by the environment because it's a non-clinical setting. And I think a lot of people have this sort of expectation of it being very clinical and very, very white walls and sort of quite off-putting in one way. And then the 5th part of the model is partnerships and referral pathways. A big part of what we're doing here today is increasing our awareness in areas outside of the Liverpool region. So a lot of people do assume because we're based in Liverpool that we'll only see Liverpool clients, and that's not true. We'll see people from anywhere as long as someone can get to us safely and it's effective for them. We have had people travel from North Wales, from Birmingham, from even further afield. So we will see anybody in our centres, providing you can get to us safely. It doesn't matter about someone's location or postcode. So I mentioned there that first part of the model at James's Place is around the man themselves and our intervention that we offer men, and that's lay your cards on the table. I'm just going to hand over to Claire a little bit. Claire, no, it's difficult without the slides, but if you could, give us a bit of an oversight of that, please.
Yeah, I just wondered as well, because I'm in one of our therapy rooms. I just wondered if I turn my computer around, I can kind of hopefully give a little view of the room and hopefully not make people too travel sick. But I just thought I'd show you the space that I'm in. So we've got a little sideboard kitchen with a what's it called, a kettle. But in terms of the room itself, if I turn around, so we're in a lovely Georgian house, quite high ceilings, and then every room is kind of similar. As much as with the fireplace and settee, 2 really comfy chairs, So as Andy said before, I feel very lucky to work in this space. It's a very spacious space. So it's, kind of, I think when some guys have come to us before and they do see the difference in how we are, it is very homely, it's very inviting, it's very warm. In terms of kind of the vibe that we have here. So just thought I'd show you that to begin with. So yeah, in terms of kind of how we work with gents, when we offer a gent that welcome assessment, that first assessment, we go through kind of what is happening for them, kind of what are the factors that are there. But one of the things that we really emphasize from the very beginning and all the way through is our collaborative work together. And we really start that as well in that welcome assessment, where we do what we call a Safe for Now plan as well, which is a kind of a briefer safety plan, looking at kind of, what little things, not little things, but what things can we put in that are very specific to that gent about what they can do to keep themselves safe. Obviously signposting and numbers and advice for A&E and 111 option 2, all those things. So from the very get-go, we're always thinking about suicide prevention. And I've started saying to the gents that I see, I kind of see us as being a bit of a foundation. So when somebody's coming to us in that crisis, because we are such short-term intervention, it's about helping them to get a bit of stability from where they can then go on, if they want to additional resources, additional services that we link into. So that Safe for Now plan goes right from the beginning and through every session that we do, kind of adding strategies to that as we go along, and as the gents themselves kind of bring things that they've realised that's helping them. So yeah, so lay your cards on the table. So we've got 4 sets. They're kind of the blue, yellow, red and grey, we call them. But basically, they kind of go through what would be seen as a psychological formulation. So with the first set of cards, and although we say this is the first set of cards, we tend to, with different clients, do it in different orders. If somebody is really, really struggling to kind of find any kind of safety strategies, I might start with the how can I get through this, which is looking at, gives about 30 different suggestions for ways to kind of manage suicidal thoughts and stress. But so this first one is about what's happening right now, and this helps the gents because this is split into 4 parts. Again, different therapists do it in different ways. Sometimes I split the cards in a pack of 2 because this is the biggest one that we've got. I will kind of separate out the thoughts, feelings, physical sensations. So it has a lot of the physical sensations that are the symptoms of anxiety primarily, but some depression symptoms. And then also behaviour. So what is somebody doing or not doing? So I can't get out of bed, or I'm not seeing friends, I'm not doing things I used to enjoy. So the way that we do this is just give the gents the guides and just get them to choose which ones are relevant for them. It's really, really wonderful because even the guys do it differently themselves. Some people will go through and literally really think about every single card and be yes or no, this is something relevant to me, want to talk about it that way. Some will go through and put them all in a pile. I've had gents do a yes, maybe, and no pile. And what is really good about this one in terms of the thoughts and feelings, it helps make connections between what's happening in terms of the thoughts that they're experiencing, but how that relates to their feelings as well. So we're already trying to get that conversation and the way that we want to speak about how we can notice that connection between what we're thinking and we're feeling impacts how we behave. So it is CBT based to a degree, but there's a lot in there that we can use within this set. And then, as I say, we kind of go, so we've got, how do I get here? It's a bit harder. It's nicer to do this in person because you can pass the cards around and you can have a look through. There's all kinds of different things in here. So how did I get here? This is our 3rd or 4th iteration of these cards, I think. And so we've added in, through experience, we've added in things such as, for example, discrimination, homophobia, different things like that things that weren't in the original kind of set of cards that we're coming up against. And it just helps the man make the connections again between kind of what has contributed to where they are. Sometimes guys really do know what it is that kind of connected to why they feel like this. A lot of times that they're not making that connection, and that's not through like lack of intelligence or lack of kind of ability. It's more, if you've just not had that kind of those people around, if you've not been raised in certain ways where you talk about thoughts and feelings, or where you're raised where kind of masculinity, you don't talk about your feelings, you don't share these things. So actually it can be quite empowering for gents to kind of like, oh God, yeah, you know, my childhood wasn't great, or this happened, or this bereavement happened, and you know, but that was like 10 years ago. That shouldn't impact me now. So it's a really good way to help gents kind of see that there's different things that can impact them. I always, and I know a couple of my colleagues do the same as well, I always have an extra little sticky pad so we can put extras in there that are really specific and personal to that individual as well. And that works throughout because, you know, as I say, we kind of cover quite a lot in these, but it's not everything. So how did it get here? What's keeping it going? So this is then very much kind of what are the things that are in our control and what are the things that are not in our control. I use this pack as in terms of what are the things that we can work on, what are the things that we can link you into in terms of other services. Again, this has kind of like a lot of the similar ones to the other ones. Someone's bullying me. I don't see my family, so if there's like family breakdown, family issues, so yeah, and then as I say, the very last one is how do I get through this? So this has then got things like don't hesitate to ask for help, structure my week, plan my night the day before. Also kind of using relaxation, mindfulness. So it's got a nice wide range of different practical and psychological things in there. That one I nearly always have sticky pad, and we get at least 5 to 10, if not more, specific things that the guys suggest that they do. So things that they've done in the past that they've not done for a while, stuff that they'd like to try. I always ask them to think about, and also things that, you know, maybe they know sort of friend uses certain strategies. How about trying that out as well? So we're constantly kind of given those tools and that suggestion and very much that idea of kind of like we don't, although the thoughts are there, we don't have to act on them. We do have the choice of kind of how do we respond to that. So yeah, we're 6 to 8 sessions. I don't use all the sets of cards with everybody, and I think probably my colleagues are the same as well. We use them in different ways, so it is quite unique to the gent as well. So even though the intervention is those 4 set of cards, if you were to look at our kind of notes for each gent, it is very unique to what's happening for them as to how we use those, and also what the guys themselves get from those as well. And we also then kind of tie it all back in at the end with that bigger safety plan of kind of now you've looked at kind of what were the things that were triggers and warning signs. What can you do, which is how do I get through this? What is the other supports around? So we do a lot of signposting at that point as well. Yeah, I don't know if anybody's got any questions on that. No? Okay.
Yep.
Oh.
Yeah,
Are we able to purchase those cards, get packs of those cards?
Right now, no, is the answer, but it's a question that we can take back and see. I've had a couple of gents actually ask me that as well. So I've had a couple of gents as they finish. So what we do is we encourage the guys to take a photo of the cards that you know the selections that they've made and the additions that we've added. It's a really useful tool, particularly because we do really encourage all our gents to have a supporter as well. So whether that's a partner, a family member, a friend. So we do encourage that they share the safety plan with that person. I also encourage them to share their cards as well because it helps explain if they've really struggled, particularly if it's relationship breakdown, particularly if it's family issues, if they've really struggled to explain how they're feeling, you know, what's happening for them, the cards are a really good starting place for them. So men have asked for those as well. I don't know if you want to add anything else, Andy.
Yeah, I know it's been discussed in the past as well, which would be great. I know there was someone who really wanted to purchase the cards or get access to them because they wanted to use them as part of the therapy with people. But as it's based on a risk formulation, it's based on, for anyone who likes reading theory, the cards are based on the IMV model, which is Rory O'Connor's work. So because it's a psychological formulation, it could be quite, if someone not qualified was to deliver it, it might not be safe, it might not be effective. So the decision was made no, but we are looking at ways that we can you know, see as a communication aid is the way that we can get them out to people that would like to purchase them or to, you know, to have them. So you might have to leave that one with us. We'll feed it back again. Thanks, John. Yeah, as I just mentioned there, if anyone wants to read that work of Rory O'Connor, he is, he's absolutely brilliant in the suicide prevention space. The work that he does is second to none, and we base a lot of our work off the learnings of his data, his research. But yeah, I'll just go through a few more things, and then we can open it up to further questions if anyone does have anything. So who we work with? Thanks for that, Claire. That was really good. So who we work with then? So we work with men who are aged 18 plus. That's anybody who identifies as a man over the age of 18. We have just done a pilot program for 16 and 17-year-olds, which is now closed within the evaluation stage, and we're hoping in the future we're able to open up our pathway to 16 and 17-year-olds as well. But for the time being, we are 18 plus. It's for men who are experiencing a suicidal crisis that's been caused by a life event. So what that means is what I talked about before: bereavements, relationship breakdowns, divorce, family issues, work issues, financial stresses, those kind of things that can make men feel quite defeated, potentially humiliated, and ultimately trapped with no what feels like no way out. The way I always describe it is a bit of a something called cognitive restriction, where we've all got a lens of options available to us. And for the men that we see, the lens of options has been narrowing very quickly to the point where it's laser focused on suicide being the solution to deal with the circumstances that they're in. So what we're able to do as a service, by getting in quickly, we're able to put a hold on that lens, closing completely, while we start working with them to understand their crisis and then looking at ways to open it back out. And that's ultimately what we do in 6 to 8 weeks. We get in very quickly. We've got to be brave. We've got to be direct with this situation. And we openly figure it out together with the man using the cards. So that's the man that we're working with, someone who's identified suicide as a way to manage to deal with the way they're feeling. It's not often men who want to die, believe it or not. It's men who want to escape. It's that desire to escape the circumstances that they're faced with is the men who walk in our doors. And unfortunately, we know, well, we can guess, and from information we do have, a lot of the people who do die by suicide, that's the situation that they're in. So it's someone who's experiencing, a plan to end their own life. It might be someone who's got the means to be able to end their own life, or it might be someone whose thoughts are very intense to the point where they're not able to function in life. They're not able to go to work, or they're not able to go to college, or whatever it might be. Their life is impacted significantly because of the intensity of their thoughts. So that's the man that we work with. A few inclusion/exclusion criteria. If someone did have an addiction that would make it unsafe to engage effectively in therapy with us, then we might not be the right service. We might need someone to engage with drug and alcohol services, or it might be blood addiction, or whatever that might be. But we'd be naive to think that we wouldn't work with anyone who drinks alcohol or takes drugs, because we know that people who are accessing the service use those mechanisms as ways of coping. So what we do just ensure is that it's managed enough so someone's not turning up to therapy sessions under the influence, if that makes sense. Also, as well, our service is designed for people in that crisis driven by life events. If someone's in a crisis driven by a mental illness, such as a bipolar disorder or psychosis, then there'll be other teams that have got a wider range of treatment options available to them that would be best placed, such as the crisis team or statutory NHS mental health services. We'd be doing that person a disservice by working with them, because we've only got that one psychological treatment option. So I suppose that's who we work with and who we don't work with. And the last part of that is someone who's willing to work with us. There's plenty of times where, I'm saying this lightly, but plenty of times I'd love to get someone in a headlock and drag them down to us because I know the benefit it'd have for them. But ultimately, we need the person to be willing to walk into our door and engage with us, and be willing for us to share information with the GP, which is quite soft touch, really. We say to the GP, they're here, we're working with them, and we'll let you know when the person's discharged. And that's what we do. We let them know when the person's discharged. So there's not much information sharing unless the person wanted us to, and we'll work with them to do that. Yeah, so that's a little bit about what we do. A bit of an example, which you'll be able to see on the slides that I do send over to you, is we've changed the name of someone called Trevor, a 32-year-old man who was isolated and has recently split up with his partner, causing him a lot of distress. And he's reported to a practitioner, he's reported to a GP that he's got intense suicidal thoughts and he has a plan to take an overdose. So that's the information that the GP has. The GP provides us with a referral. So this was an actual case that we deal with. So we received a referral on a Monday at 12:15, or approximately 12:15, and we made contact with Trevor the same day at 4:30 to invite him in for a welcome assessment in 2 working days. And his first appointment was with us on the Tuesday, 2 p.m. The next following day. And that's very common for us at James's Place. We have got a 2-day turnaround standard that we I don't know how at times we've done it, Claire, but we've always maintained that sort of quick turnaround. We've never had to close our never had to have a waiting list or close our doors. And that's been difficult when you can imagine we've got a huge PR piece. So, I can speak openly about it. He talks about it himself. But Paddy Pimlett, who's a mixed martial artist, spoke openly about coming to James's Place in the past and how it saved his life. And on the back of him doing promotional work, we've received a lot of referrals, probably from men that we wouldn't normally target through our social media channels and what have you. And we've had a huge influx of referrals at a time, and we still managed to see people within that quick turnaround. That is probably the biggest strength of our service. And hopefully you take reassurance if you come into contact with people that we do see people very quickly, sometimes the same day, but obviously we can't, depending on how acute it is, we can't always guarantee the same day. But definitely within 2 working days at the latest. Moving towards the end now. So how to refer someone to us then. So on our website, I'll put the link in the chat as well in a minute, www.jamesesplace.org.uk. On every page on the website, there's a banner going across the top, and it in the orange top right says get support. You can do a self-referral on there. You can do a referral for a loved one or a friend, a colleague, or you can do a referral as a professional as well. So all the 3 routes are all on there. What we do ask, there's a box saying details of suicidal crisis. Just give us as much information as possible that you can in that to help us understand if we are the best place to support someone. Because the likelihood is if it's unclear, we might have to go to find out further information from you or the person themselves. Whereas if it's really concise information, we know we can offer someone a welcome assessment there and then. That's it from me, from my talking way through it, but there may be questions that have come up throughout the presentation. I've just seen something in the chat. Oh, there we are. The website's gone in there. Is there any questions at all from anybody about the service? The visuals might really help it to bring it to life a little bit more. And as I said, you're more than welcome to come to open days in the future. But is there anything? Oh, Kathy?
Yeah, thanks for that. Very informative. But you talk about, when you're talking about seeing your referrals, you refer back to they have got to get to you. So do you do anything maybe online with people over the phone, or have they actually got to physically every session get to Liverpool?
We are a face-to-face service, so during COVID, I know that people, we adapted the service to provide online and telephone appointments, but we are a face-to-face service, and that's driven by our data. Our data clearly evidences that our impact is much stronger when we're a face-to-face service, and with the cards as well, a formulation that our model is based on those sort of cards. But we are always as you can imagine, as a charity with limited resources, we have to make sure that we can maximise the effectiveness of our approach. But that being said, we are working on ways that we can continue to work with communities, that, you know, through the use of technology. We're always looking at different ways that we can engage with people in different means. So it's not something that we won't, it's possibly that we won't be doing face-to-face forever, but at this moment in time, with our resources, that's what we know is most effective and we can sustainably provide.
Can I ask how many people you've had come through your door from Halton? Do you have those figures?
Not off the top of my head. I think I did send some over to Katie and Aileen earlier this year. So for the last, so it was 2023 to 2024. It's not for how close Widnes and Runcorn are. Probably over the years not been as high as that we would like, because we know there's, you know, obviously a lot of people in distress in those areas. But what we have seen is since Merseycare have taken over Northwest Boroughs, the first response service based out of Hollands Park, the referrals route has seemed to be improved over the last couple of months, which has been positive. But we want to make sure that we're, you know, services in the Halton area and people themselves are aware of us as a service, and, you know, an opportunity to get to us for treatment if they're in a suicidal crisis. If that makes sense. Aileen, Katie, do you have them numbers?
Not to hand, but what we can do is when we send out the slides, we'll include those numbers. But I think they were fairly low in comparison to the Liverpool figures. But I think that stems from the fact, I mean, I didn't know that James's Place could be accessed by anyone outside of Liverpool. So obviously one of the things we want to do is raise this awareness, so those who are able to physically get there, I mean, because being able to be seen and assessed within 48 hours is amazing. Then we want to increase that option to men locally. So yeah, we'll find those figures and send them out if that's okay, Kathy.
Yeah, I mean, one of the other things I was going to say, Andy, is that at the moment, Health Watcher, we're actually collating some information for the Mental Health Alliance around services that are available to Halton residents and patients. So do you mind if I include you when I send that out? And I'd be happy to get feedback that way.
Of course, that'd be great, Kathy. Thank you very much. I think it's worthwhile noting as well that we do offer support for people to get to us via travel passes as well. So we do have people who are travelling to us that we can support with a travel pass. So that might be worthwhile noting as well for everyone here. But Kathy, if you're sending anything out, people financial issues might see it as a barrier to being able to get to us. But we do support people via, you know, trains, buses, those kind of things.
Yeah.
But that'll be great, Kathy. Thank you for the offer of that.
Yeah, if I can just get your email at the end and I can send that over. It'll probably be tomorrow.
Yeah, lovely, Kathy. Thank you very much.
Thank you.
Sammy?
John was before me, Andy.
Oh, sorry, John. I just see you were above Kathy. Sorry, I just seen your hand up. Sorry, John.
That's all right, no problem at all. Thank you. So I live in Runcorn. I've recently become a mental health ambassador with Space. Don't know whether you've heard of them. Very good. Led by a really nice lady that's very proficient. She's got a master's psychology and counselling. Would you team up with those people? Is probably the wrong wording, but would you signpost to somebody like Space? Because although they are mental health based, quite a few of them are suicide trained via the Assist program and some other stuff. I mean, I've not spoken to Space about it. I'm not speaking for them, but it's certainly an idea.
Yeah,
absolutely. Absolutely. John, Claire, do you want to take this one and just share a little bit about our collaborations we've already got?
Yeah, I was just going to say, I mean, we do collaborate with, for example, we've got Sean's Place who are very close to us in Liverpool, but what we do towards the end of our work, as I said earlier, is we do a lot of that signposting, so we make sure that the gents are aware of all services. And obviously I've worked with a couple of people, St Helens, Widnes Way recently, and make sure that we try to give them services that are in their localities. That is definitely something that we can add to the resources that we're aware of. it's great for us to kind of get, you know, as you're getting more, you obviously Widnes is getting a crisis cafe at some point soon, isn't it, as well, which is really needed in that area. So yeah, we always add that in. So kind of like, you know, the NHS services, any charities or kind of community interest companies that are available that men can access. Sometimes we do the referrals for them, or it might just be a case of kind of giving that signposting and they can take that responsibility to see what fits for them. But yeah, that's great. Thank you.
Yeah, more than happy to pick that conversation up as well, John. We set ourselves up as something that other people can't replicate, and we can't replicate what other places do, and we need other spaces just as much as other spaces need us. So that collaboration is key when it comes to keeping that person in the middle and finding what the best support system for them. So we can pick that up definitely, John, if that's something you want to explore further. Sammy.
Hi, Sammy Ashley, the head of Amparo. Amparo is the commissioned service by providing post-pension support across the area, and I'm more about sort of like promoting you, Andy. We use and direct to your James Place all of the time, and we've also linked in with helping out with the Birmingham project when that was first started, because we're in other areas of the country, so it's good to know that support is there as well. And we also get that collaboration coming back, so we also get that people have been to your service and then they're signposted back to Amparo as well. So I just wanted to give you a thumbs up really and say it's fantastic.
Thanks, Sammy.
Okay.
Yeah, again, we'll often be referred to by a service. It might be, there's other bereavement type services. Liverpool Bereavement Service is an example, who might refer someone to us because they've recognised their level of intervention and their provision isn't suitable for that person at that time. And we can do our piece of work, but we'll always link back in as well. So a bit of reassurance for any professionals in the room who refer someone onto us. We'll always keep you updated as well of where things are with our communication. I think one point as well I didn't mention, thank you a lot for that, Sammy. One point I didn't mention as well is how many people we've seen. So our recent figures have shown over 3,600 people now have accessed us at James's Place, and that's across the 3 sites, predominantly in Liverpool because we've been open since 2018. So we're expecting that number to continue. And I always use the figure of how many people have accessed the service quite lightly, because it seems like it's that those numbers are forgotten about, but they're individuals, they're individual dads, brothers, uncles, sons that have accessed us. And it's but it's just incredible to see what started in 2018 and Liverpool is growing and growing. So yeah, I just thought I'd mention how many people we've been able to support in that time as well.
Andy, there's a couple of questions in the chat.
Okay.
One here from Dean Allen. How do referrals work on behalf of a loved one? Professional referral. Is consent needed for both?
Yeah, so that's one thing. So on the website, one of the questions will be, is the person aware of the referral being made? So what usually happens with family and friend referral is that we'll always contact the man off the back of that to get an understanding of where things are for them. But we may, it depends on the situation, but we'll either contact the man straight away or we'll contact the referrer straight away for the family or friend if we need more information beforehand. And we'll always make sure that that person's aware of the referral, because we don't want them obviously picking up the phone unaware of that situation. So you do need to be aware of it, and the same as a professional referral as well. But we'll always keep the referrer in the loop with what's going on at that time. Hopefully that's answered it. If it hasn't, please let me know.
Perfect. And just another one here from Rachel Lund. Is the facility wheelchair accessible?
We do have a ramp. That's one thing that we do need to try and improve, and we're looking at ways of improving the building. But we do have a ramp, which is quite narrow. To be fair, we are working on it because just the way that the old style Georgian house is set up. So we do have a ramp, but it can be difficult. It has been difficult in the past. When I said before, Kathy, as well, one point I should note, and it's linked to this, is we do deliver a face-to-face service. However, we're not, if someone did have a reason why, so such as accessibility issues or maybe an illness. So, for example, someone's come to us before who's been going through chemotherapy, and they've said, I can't get to the building because my immune system isn't strong enough. We have done online sessions for that, but we have to be very clear with the person of what service they're being offered instead of in person with the cards, if you get me. So we're able to do a good piece of work, but it's not necessarily typically how we work with the cards with the person, if that makes sense. I should have mentioned that before, Kathy, and hopefully that helps with that question has just come in. We do have accessibility in terms of a ramp, but it's quite difficult because the door is quite narrow as well. So we are working on improving that accessibility, but at the same time, we wouldn't turn someone down who wouldn't be able to access us, if that makes sense. Claire, is there anything on that yourself?
No, I think you've covered everything. Like you say, it is where we would use online is exactly those situations. We have had somebody, like you said, with chemotherapy, somebody with particularly physical health conditions who couldn't get in. As Andy says, it is an old Georgian building, so the steps are quite steep where the ramp is when we use the ramp. So we do need to get that sorted out better, really, for accessibility.
Yeah.
I think Pauline is next for a question.
Hi, Pauline.
Hi, I run a charity in Halton for refugees and asylum seekers and vulnerable migrants. And currently, I've probably got at least 10 suicidal men, and some of them actively suicidal, ones in hospital at the moment. So in terms of interpreters, do you have access to interpreters for different languages?
We did have a trial of that in the past, but due to complexities, we had to stop using the service. But it is something under our that we're working on at the moment. It's not a service that we provide at the moment. We don't have it set up, but we are working at bringing it in through our EDI principles, and sort of we've got a work stream focused on this at the moment of making sure how do we translate what we're doing with the cards, make sure it's safe, make sure it's effective, because we do have asylum seekers who access us at James's Place a lot of the time, who you'll be more familiar than me with, is feeling very trapped because of their status or their situation, leading to really increased levels of distress and suicidal ideation on the back of that. So we do have people, and we do work with people whose English isn't the first language. It's when there's a real clear language barrier, we could struggle at the moment, but we are looking at ways that we can provide an interpreter service again, because we need to be, as I said before, reaching the communities that we want to be working with. We're classed as L8 in Liverpool, which is Toxteth, a very multicultural area. We do have we have Asylum Link in the area, and we want to make sure that we're providing a service to all our community. So it is something on our list that we're working towards, Pauline.
Okay, thank you.
It might be something as well, potentially, if you're up for it, that I can link in with, so we can take some learning from yourselves and how we can best do that. Obviously, that's not our strength, that's where yous fit in, and that's, I suppose, where the collaborative approach could really be helpful. Yeah, well, thank you.
There's another question here from Chris.
Okay.
Hi, so I was just following on from Pauline's question about interpreters. I think one of the things I've experienced is cultural and religious sensitivities towards suicide. So it's better to have named or specific translators who share your principles and ethics, because I have been in situations where the translator has taken it upon themselves to berate the person for what they're disclosing.
Yeah.
So it named specific translators who share your ethos are better than just using language lines, say, for example.
Mm-hmm.
Yeah.
Yeah.
I again, limited with my opinion, because it's not my strong point, but working in the NHS as a nurse using language line, some of the time it was great, some of the time it wasn't great. You know, I had exactly the same situation, Chris, in my previous role, different dialects and things like that. So it can be a real challenge, and I suppose it's just with the sensitivity of the risk that we're working with these vulnerable men. We have to be really careful. But that being said, that shouldn't be a barrier to us moving forward with that. But Chris, I think that's a really good point for us to consider. Thank you. Is there any other questions? Is there anything in the chat? I can't quite see them.
No, I'm monitoring the chat. No more.
No. Okay. Well, I suppose I'll finish up there. I'm going to Aileen, Katie, if you can send across mine and Claire's email address off the back of this. Any questions that do come up, please send them over to us. Thank you for the opportunity to present in front of everyone today. Hopefully people took a lot from, even though you didn't have the visuals. I will send that over. You know, I've recently lost a friend myself to suicide who lived in the Halton area. Part of my upbringing was in Halton, so I was very keen on getting us into this forum here today. So I do appreciate everyone's time.
Thank you so much to you both, and myself and Aileen can attest to visiting yourselves and how welcoming and just homely the environment is, and just what a difference that makes at putting you at ease straight away when you walk through the door. Just to let everybody know that the information for James's Place and ways to refer is on the Need Help Now section of Calm Your Mind. So we'll put the link of Calm Your Mind into the chat. But for those who don't know, if you just type in www.calmyourmind.co.uk and go to the Need Help Now section, all the information on James's Place is there. So please do spread the word to those who live Widnes Runcorn and wider. You know, the amazing intervention that James's Place provides is truly unique, and the more people we can make aware, the better.
Katie, can I just add, just at the very end there, it's just if anybody is unsure about referring somebody, if you're not if you don't feel certain or you've got a couple of questions, just ring us as well. So our clinical administrators who answer our phones are excellent at kind of helping, discuss what it is that would be a suitable referral, but also, kind of if we're not the right place. But it can just be really helpful if you're unsure, give us a ring, let us talk through, let us help you make that referral if that's what you need. Okay.
Perfect.
Really
Thank
helpful.
you.
Thank you, everybody.
Thanks a lot. Nice to meet you.
Thanks, everybody.
Take care.
Cheers.
Look after yourself.
Bye-bye.
Bye.